Good afternoon. Welcome to Optimal Care Pediatrics. I'm Dr. Monique Mondesir, physician owner of Optimal Care Pediatrics, located in St. Lucie West. And with me today is pediatric cardiologist, Dr. Jaime Alkon, and he's with Kidz Medical. They recently opened up an office in Port St. Lucie. And today we're going to be talking about pediatric heart defects, cholesterol, and high blood pressure, and answering some of your cardiac questions. So first question, how common is it for a baby to be born with a heart condition?
That's actually a very good question, and that's a common question. Congenital heart disease is one of the most common, actually the most common lesions that can potentially happen in a human being. If you compare all the organs in the body, the one that can potentially get malformed more frequently is the heart. It's about 1 out of 100 pregnancies, and that works out to about 40,000 cases of some form of congenital heart disease in the United States annually.
Okay, excellent. And can a heart problem be detected before a baby is born?
Yes, certainly. When, of course, you are going to pregnancy, you're going to see the obstetrician. The obstetrician is going to be looking at the baby's heart. If they have some kind of suspicion that there is something wrong with the baby's heart, using the ultrasound, they can potentially send the patient to a heart doctor like myself to do a specialized test, which is pretty much the same ultrasound they do, except that we use our expertise to look at the baby's heart inside of the womb. There are certain potential problems that illnesses that mothers may carry, or certain conditions that they may be at, prior to pregnancy or even during pregnancy, early in pregnancy, that can predispose babies to develop some heart problems. One of the most common ones is diabetes. If mom has diabetes, meaning that there is very high sugar levels on the blood prior to getting pregnant, and those levels are very high and not controlled, there is a more than 2, sometimes even 5 times risk of developing some form of congenital heart disease, meaning the babies might be born with some kind of problem in the heart.
So what about moms who develop gestational diabetes, or they develop diabetes during the pregnancy? Are those babies still at risk for heart problems?
Much less. Really, it seems to be that the main concern is to have high blood sugars prior to conception. There is something about the sugar levels prior to conception, because it's been shown also that if you are diabetic prior to conception and you get to control your sugar levels very well, then you have the same risk as anybody else in the population. If you develop diabetes during pregnancy, even though you don't necessarily have a very high risk of developing congenital heart disease, if the sugar levels are not controlled, you can potentially develop the heart, the walls become thick, pretty thick. And there is a direct correlation of how high the sugar is in mom with how thick the walls can become. Most of the times after the babies are born, those kind of like walls of the heart go back to normal.
Oh, good. Okay.
But there are certain small percentage of kids that can develop some kind of abnormality in the muscle of the heart.
Okay. So if a baby is born with a heart defect, what sort of resources and supports can you recommend?
So I think one of the first things to do once the pediatrician has identified that there is a problem, some kind of problem with the heart, is refer the patient to a pediatric cardiologist. We have the knowledge, the expertise to be able to explain exactly what is going on with the baby's heart, and at the same time provide the correct diagnosis to the family. In that way, we can guide them to go and read up the appropriate literature or the appropriate diagnosis. And it's certainly confusing when you go and you look it up on your own, because a lot of things online can not be necessarily what you're dealing with.
Right. I always say, look at the resource, who wrote it. And I say, sometimes Google will put the worst thing, the most terrifying things, so you have to be a little bit cautious when you're Googling. Look at the source. All right. So your pediatric cardiologist, your pediatrician are good sources for information.
I agree. Yeah.
And moving on to older children, can children get hypertension or high blood pressure?
Yes, and I would have to say that is a problem that we're seeing more and more. Definitely over the past, 10 to 20 years has become a much more prevalent problem. Um, there are certain conditions that you can be that you have that you may have gone through life that may put you at a higher risk of developing high blood pressure. For instance, if you are taking certain medications, common medications that are used for asthma, like steroids,
Okay.
those medications can increase the blood pressure. So, if a patient comes in to see the pediatrician and we notice that the blood pressure is elevated, one of the first things we want to know is this patient somehow taking any kind of medication that can potentially raise the blood pressure? The reason being, we can stop the medication and everything goes back to normal.
Good.
And the same way that that's one of the risk factors, there are a few others. Like for instance, if you were a child born prematurely, or if you were a child that developed some frequent infections, urinary infections, your kidneys can sometimes be affected, and that can increase the blood pressure. So there is a list of conditions that can potentially predispose you to high blood pressure. Having said that, there is a completely different group where we do not know exactly what can potentially be raising the blood pressure, and those are the ones that I was referring are happening more frequently. Um, we we know that there is an association between being overweight or being actually have too much weight and have blood pressure being elevated. And there are several studies that have shown that if you actually can lose weight, your blood pressure may go down, which is a great thing. Remember, the blood pressure is something that we check in terms of um, um, when the heart is sending blood to the body, how much work the heart needs to do, and then when the heart is relaxing, how much work is the heart doing. So we all have blood pressures. It's just something that is natural. It's generated by the heart sending the blood out to the body, but they are normal levels. So when you go above the normal level, that's when you are said to have high blood pressure.
Okay. So then what are the long-term consequences of having high blood pressures in childhood?
Well, one of the concerns that we have is that if you present with high blood pressures as a child, you have a much higher risk of developing high blood pressure as an adult.
Okay.
And high blood pressure in adults has been associated with an increased risk of developing heart problems as an adult. And when we look at adults, we try to make all those potential risk factors to develop heart problems go away. One of them commonly being high blood pressure. In the short term, one of the things that can happen is that if your heart is sending blood out and the pressure is high, that means the heart is working extra hard. And by working extra hard, it's kind of like going to the gym. You go to the gym, you start, pushing some weights, and then your muscles become, stronger and thicker. The same thing happens to the heart. If the heart is actually working, with a person that has elevated blood pressure or high blood pressure, the walls of the heart become pretty thick. And it's known that once the heart walls become pretty thick, that can actually increase the risk of developing more heart problems.
Okay. So what can families do to modify or reduce the risk of high blood pressure?
Yeah, that's a great question. So if we know, for instance, what is causing the blood pressure, we should attack that particular cause so the blood pressure goes back to normal. If we do not know what is the reason for the high blood pressure, there are still things that can be done. For instance, if we know that somebody has high weight, drop the weight, using exercise and an appropriate diet. One of the most important factors really is to, keep an appropriate diet that allow us to, you know, um, drop weight. What I mean by that is not a specific, fat diet or any new diet, but a balanced amount of food that we eat to try to, be as close as possible to our ideal weight.
And how does salt play into this?
Yeah, thanks for that question. So salt is one of the things that we know can potentially raise the blood pressure. The reason why that happens is because salt kind of like retains water inside of the blood vessels. So one easy measure is to control how much salt you're eating. So along with losing weight, if you can decrease the amount of salt that you are taking in a given 24 hours, that also has been shown to decrease amount or decrease the blood pressure. The American Heart Association recommends not to go over 2,300 milligrams of salt a day in your diet if your blood pressure has been found to be elevated.
So foods can have salt even though
Yes.
you're not like adding salt with the shaker,
Correct.
correct? Okay. So those are like your canned goods, and salt's also known as sodium, right? So when you're reading labels and you see sodium, that's the same as salt, the salt content in the food.
Absolutely. And patients that have been told that have blood pressure that is high, one of the things that they're going to probably have to do is start watching those labels and see how much salt is in the product that they will consume, and potentially even decrease the use of the salt shaker during their meals.
Excellent. And what about high cholesterol? Can that run in families?
Yes, I mean, cholesterol is a term that we hear a lot. Cholesterol is a product that is, produced by our own body. So we all have cholesterol, and you can also eat cholesterol. I mean, there's a lot of products that we eat that have cholesterol, like for instance, meats and eggs, and a variety of other, animal products. And it's not necessarily bad. It's actually a great, fat to have. The problem is that cholesterol, when the amount of cholesterol in our blood is too high, that also can be associated with the early development of heart problems. More specifically, problems in what is called the coronary arteries. As you know, we know the coronary arteries are vessels that we all have that give the blood to the heart muscle. And if your cholesterol levels are very high, those blood vessels can start getting some deposit of fat inside of them, and in the long term, when you become an adult, can potentially block, and that can potentially lead to severe heart problems.
Okay, excellent. Seth, thank you for that explanation.
Yeah.
So there are good cholesterols, right?
Yes,
So not
absolutely.
all the cholesterols are bad. Can you talk about that?
Yeah, absolutely. So when you look at total cholesterol, the cholesterol really is divided in different particles, and they have to do with the size of them. One of the most concerning one is the one that we call LDL cholesterol. LDL cholesterol is a particular type of cholesterol that can deposit inside of the coronary arteries, and those are the ones that can contribute to obstruction.
Okay.
That is probably the one that we call bad cholesterol. The other one is the one that is called HDL cholesterol, or high density lipoprotein. HDL stands for high density lipoprotein cholesterol. That's actually the good cholesterol. And good cholesterol, because we know that if those are actually, that particular subtype is in high levels, it can sometimes protect you from developing heart problems. There's been a lot written about, for instance, whether alcohol can help you increase your levels of HDL. And some studies suggest that if you have maybe 1 or 2 glasses of wine, on a regular basis, that can help you increase the good cholesterol. Of course, that is not a recommendation for our kids to go and drink alcohol,
Let's
but
make that clear.
for adults, it might be helpful.
Okay, thank you.
Sure.
And what age should we start looking at blood pressure and cholesterol tests? When should we start testing and
Yes,
doing those?
that is actually a great question. So, as far as blood pressure, the recommendation from the American Academy of Pediatrics and American Heart Association is to check the blood pressure at the age of 3. I think that most of us who have tried checking the blood pressure in small kids, we realize how difficult it is. Babies are moving, and sometimes you get a number and you don't even know whether that's accurate or not. So usually 3 years of age is a pretty good time to start checking blood pressures on a routine basis. Having said that, when a baby is born, if there is anything specifically on the baby that makes us suspicious, that it might be high blood pressure. So for instance, the baby is being examined by the pediatrician, and the pediatrician cannot feel the pulses in the legs. Usually what happened is they call the cardiologist, we come and we acknowledge that indeed we cannot feel them either, and we end up doing some testing, and we realize that there is some obstruction of the blood leaving the heart. If that happens to a newborn, that needs to be corrected and oftentimes needs, surgery. Make sure, having said that, oftentimes that is a very small percentage of the population. A general screening should be done around 3 years of age. And if the blood pressure is, found to be elevated, that needs to be followed for the reasons that we have discussed before. With cholesterol, the recommendation really is to see whether there is a family history of high cholesterol. So if you encounter a family that, is known to have very high cholesterol, we need to make sure that those young babies as young as probably 2 years of age don't carry the condition that can actually give them very high cholesterol. But in general, if none of those factors are present, the recommendation for a universal screening should be before puberty. So somewhere between 9 and 11 years of age will be a good idea to actually obtain a lipid panel or fat panel that which give us the levels in the blood of the different kinds of cholesterol. If for whatever reason they are found to be elevated or completely out of the normal range, 6 weeks later they need to be repeated, and then we need to decide based on those numbers what is the next course of action.
So when would medications be started for cholesterol or high blood pressure?
Well, in general, if you look at the recommendations in 2017, the American Heart Association put out recommendations for the management of high blood pressure. So there are certain levels of blood pressure. To answer your question, if you present with elevated, what it used to be called before elevated blood pressure, now it's called stage 1 hypertension. So if you present with stage 1 hypertension, most of the times the recommendation is to try to give 4 to 6 months of what we call lifestyle modification, which is what we have discussed before: losing weight, decreasing the amount of salt, exercising, and oftentimes that can actually drop the blood pressure and we can avoid medications. If 6 months go by and the blood pressure continues to be high, then one of the things that often cardiologists do is they look at the heart. We look at the walls of the heart using ultrasound, and if the walls of the heart are thick, then that patient needs to be potentially started also on medications to lower the blood pressure, because now this high blood pressure is producing effects on the heart. If the patient presents right away with very high levels of blood pressure, or what we call stage 2 hypertension, those patients are oftentimes started on medication for high blood pressure as soon as they are identified, along with diet. So it's a little bit of a long answer, but it a lot depends on whether you have very high numbers and whether your heart is already being compromised or not.
Right. Well, it's a complicated, complicated question, complicated answer.
For cholesterol, oftentimes it's a similar thing. When somebody has a family history and is identified to have extremely high levels, we usually will start them on the medication because we know that very high levels are associated with accelerated heart problems. Most of the times, diet will be the first stage before we do anything else.
Okay. Thank you. And we're going to move on to teenagers playing sports. Now, this comes up a lot. I'm sure you get this one a lot too. Do teens have to be screened before playing sports, like with a screening EKG? And what are these screens looking for?
Excellent. So I think that every child should be screened. And I think that the initial screen should be a physical examination and a history, like we do in medicine. So you want to make sure that the patient is not having any symptoms with exercise, as we all know. And some of the symptoms that are concerning will be, for instance, developing chest pain with exercise. If you are, exercising, doing some aerobic exercise, and you develop chest pain, that needs to be checked because there are certain conditions that you may carry with you that we have never discovered before that can actually predispose you to develop these kind of problems. A child that is passing out while exercising will be another consideration. Those are, patients that should not be ignored. A family that presents for, clearance, for sport physical clearance, and tells us that, There was several family members, male members that were actually dying, early in life. So that means prior to 55 years of age, or developing some, coronary artery problems, some, heart attacks or something like that early in life. Those immediately put us at a much higher category. So those are the kind of patients that we're going to be focusing our attention to and doing, as you suggested, an electrocardiogram, perhaps an echocardiogram, and even more, maybe like a stress exercise or something like that. One of the most common causes of sudden death in a child is a condition called hypertrophic cardiomyopathy, where the heart is abnormally thick. The walls of the heart are pretty thick in a way that basically there is obstruction to the blood leaving the heart, and the patient can potentially develop some rhythm abnormalities where the heart just goes into an abnormal rhythm that makes the heart not beat effectively, and you can pass out. And if it's not resolved, you can potentially die. Those are some of the patients that we see dying, for instance, playing soccer or playing, football or basketball, and it's a situation that could potentially be revived if you are prepared for it, or it can be better, be prevented. So when we do an electrocardiogram, we're looking for evidence of high voltages with, correlate with thick walls. So if a patient comes in with a history like that, we do an electrocardiogram, which is sort of like a measurement of the electricity in the heart. And if we see very high voltages, then that's a red flag. That means that there might be some problems there. Other conditions that we look with the electrocardiogram are, genetic conditions that predispose you to having rhythm problems with the heart, meaning the heart can start speeding up on its own very fast, completely abnormally when you're just watching TV. And those conditions can be lethal. So those are some of the conditions that we normally screen for. Of course, we screen for some of problems with the heart itself. There can be some difficulty for the blood leaving the heart because the heart is not normal. So it's a long list of things that we look for. But certainly, screening should start with a good history and a good physical examination.
Excellent, thank you. And why are kids with congenital heart disease at a higher risk for getting dental caries or cavities?
That I am not really sure. Is that the correlation that I have encountered is a little bit different? Is that if you do have some kind of congenital heart disease, if you end up having some dental problems, then there is a higher chance that you might develop some, bacteria going into your bloodstream, and that can seep the heart, and you can develop an infection of the heart.
Exactly.
So that is actually a very prevalent problem, believe it or not. So what we're talking about here is a child that was born with a completely normal heart, has gone through, his or her life completely fine without any problems, and finds his or herself with a infection in the heart that can potentially destroy some of the parts of the heart, the valves of the heart. We see that. We've had patients from Port St. Lucie presenting with these kind of illnesses, and oftentimes the problems can be if you actually have decay in your teeth that are not taken care of. Some bacteria that normally live in our mouth, in our teeth, can go through the blood, and it's not every bacteria. There are some subtypes of bacteria, and they can actually get attached to the heart and produce significant damage. So, I mean, that's...
Is that why some kids have to take antibiotics? If they have a heart problem, they take
Yes.
antibiotics before a dental procedure?
Absolutely. It's been shown that if you actually are going to go and have a very deep cleaning, or the dentist is going to be doing something that requires, a lot of procedure that is potentially going to increase the risk of bacteria going into the bloodstream. If half an hour or 1 hour prior to the procedure you take antibiotics, you can potentially, kill the bacteria once it goes into the bloodstream. So there are certain patients which have actually pretty significant heart disease that every time prior to dental procedure should receive antibiotics to prevent these kind of infections.
Thank you for clearing that up.
Oh.
And what is a heart murmur? And can you talk about an innocent murmur?
Absolutely. So that's actually one of the most common things that both you and I see on a regular basis. Um, you know, um, it's a pretty common question, and let me explain a little bit. When we listen to the heart using our stethoscope, we're all gonna hear that the heart produces two different noises. We call it the first and the second heart sounds. Those are completely normal. We all have those from the moment that you're born to the moment that you die, and those corresponds to the heart opening and closing different valves or different gates for the blood to come in and out. So between the first and the second heart sound, normally there is a silence. But if you hear an extra noise between the first and the second heart sound, that is what we refer to as a heart murmur. Some heart murmurs are what we call innocent, and the term innocent really means that there is nothing wrong with the heart, and yet you can hear an extra noise. In some other conditions, you hear the extra noise because there is something wrong with the heart, like a hole inside of the heart. Some of the walls have a hole or more than one hole, or some of the valves are not letting the blood in or out of the heart, and that can also produce a noise. So those are not innocent; those are abnormal studies.
Can a
Findings.
child outgrow a murmur, outgrow an innocent
Some
murmur?
of them, for sure. So, for instance, one of the most common congenital heart disease is what we call a ventricular septal defect, or a hole between the lower chambers of the heart. So, when the hole is open, the pediatrician or the cardiologist will listen to the heart and they will hear a noise. They will hear the heart murmur. But as you grow a little bit older, some of those holes can seal on their own. Once they're gone, the heart murmur is also gone. So that will be a situation where you can outgrow, let's say, a heart murmur. It depends what part of the heart is located. So when we do an ultrasound of the heart, we can pinpoint exactly where the hole is located. And some of those holes we know for sure won't close. So some of them, especially if they're big, need to be referred for heart surgery so they can be closed.
Thank you. So that are all the questions that I have for today. I encourage you to write in if you have any more questions that you would like to have answered, and I will be posting contact information for Dr. Alkon on the Optimal Care Facebook page. And of course, you can always reach me at 772-301-0123. Thank you for joining us this afternoon. Take care.